This video is to orient you to the School of Medicine Foundations of Doctoring Phase 1 SPETA Final Exam, which takes place at the Center for Advancing Professional Excellence, also known as the CAPE. The purpose of this exam is to assess your knowledge and use of language of physical examination structures, techniques, and findings. It is to also evaluate your core physical examination techniques in a head-to-toe exam in the following body areas: general assessment for vital signs, extremities and back, cardiovascular, chest and lungs, abdomen, head and neck, as well as neurological. It is also to measure how you relate the physical examination to normal anatomy and physiology. So, about the physical exam, you will have 30 minutes to conduct a head-to-toe exam on a standardized patient, or SP. There will be a rater in the room taking notes as you perform the exam. Please do not engage with the rater unless prompted. Do not ask them questions about content. Respond and follow any prompts they may give you. There is no post-encounter to complete at the station after the exam. This will be completed later on Canvas. For the physical exam, you will be evaluated in 2 categories. 1, your communication skills, and remember to explain what you are doing while performing the exam. And 2, your physical exam skills. Things you may bring into the exam room are your stethoscope, pen or pencil, the clipboard provided by the CAPE with your schedule and scratch paper, and you may also bring your own water bottle and wristwatch. At any time during your examination, if you have any difficulties or questions, please see one of the proctors in the hallway. You can also ask to speak to the project coordinator, Donahue Hayes. Before heading back through the double doors, please take what you need to conduct a physical exam. Cell phones, pagers, and reference material are not allowed in the exam rooms. Please leave all personal belongings outside the exam room or on the shelves in the hallway against the ease windows. Once you enter through the double doors, you may not exit until you have completed the final exam session. There are 3 restrooms available behind the double doors. There's also a water cooler in the hallway between exam rooms 3 and 4. As a friendly reminder, CAPE staff and proctors are not allowed to answer any exam content questions. Also, sessions are digitally recorded for faculty review purposes. If at any time you should have issues with the door chart, please see the proctors immediately in the hallway. You will hear overhead announcements. They will start with, "Learners, you may begin." There are 15 minutes remaining. There are 5 minutes remaining. And time is up. Please exit the room. The door chart is located next to the exam room that you are assigned to. Please stand by your assigned exam room and wait for the overhead announcement to sound, "Learners, you may begin." At that time, please read the instructions in the door chart carefully. You are allowed to bring the door chart with you into the room. Please be sure to return it to the chart box when you exit. With time management, please listen to the overhead announcements carefully. Overhead announcements are given at the beginning of the exam session and when you need to exit the room. It is, however, your responsibility to track your time if an overhead announcement is not given. Please review your clipboard with your schedule, documentation template, and scratch paper. Please keep this clipboard with you throughout the entire exam. Please do not write anything on the clipboard until after you hear the overhead announcement to begin. At the end of the exam, please return the clipboard and any used or unused scratch paper to the front area. Please take the documentation template with you for your post-encounter to be completed later on Canvas. Once you hear the announcement that time is up, please exit the room. You must exit the room, even if you are in the middle of an exam component. Once you exit the exam room, you may not return into the room. Please ask the proctor to retrieve any items you may have left behind in the exam room. To do your best, read the instructions in the door chart carefully prior to entering the room. Listen carefully to the overhead announcements and treat the standardized patient as you would any other patient. And most importantly, verbalize, verbalize, verbalize. After you have completed the exam, please remember that the honor code will apply. There are other learners scheduled to take their SPETA final exam. Please do not discuss the exam or any content of the examination with your colleagues. On behalf of the CAPE staff and faculty, thank you for the opportunity in allowing us to teach you the core physical exam skills and techniques. Remember to smile and take a deep breath when you walk into the exam room. It will help you ease your anxiety. Physical examination order is not important during the exam. You can perform the exam in any order that makes sense to you. And most importantly, again, remember, verbalize, verbalize, verbalize. You got this.